The Intelli Axis system is something unique which is only available in the LENSAR femto laser cataract system. What this system does for the surgeon is that it marks the capsulorhexis margin itself for the alignment of the toric lens by creating two knuckles on the side of the capsulorhexis margin. Here in this video, we will demonstrate the accuracy of the knuckle technique created by the Intelli Axis and the corneal marks done by a gravity marker. Here we will observe the two knuckles created by the laser machine onto the capsulorhexis margin itself, which are denoting the supposed orientation of the Toric IOL. Once the capsule has been pulled out of the eye, we will try and stretch the capsule and highlight the knuckles created by the femto laser machine. Here we will see the two knuckle marks on each side of the capsulorhexis cap. These will exactly coincide with two knuckle marks on the capsulorhexis edge. Now these, if we see at the end of the surgery, will be probably off center by nearly 4 to 6 degrees from the corneal marking, which was actually done using a gravity marker, which means these marks are far more accurate in alignment and helping the alignment of the toric lens, thus giving a far more accurate picture. Here again, we will see these two marks on each side of the capsulorhexis cap. Once this capsulorhexis cap has been removed, we will go ahead and proceed with the cataract surgery. Creating a hydro wave does push the air bubbles to one direction. So what I prefer is to have air bubbles escape from behind the cataract, which makes the nucleus move far more easily and gives a good rotation. Having done this rotation makes the surgical maneuvers far more easier and comfortable. Since this cataract has been pre-chopped and pre-diced by the laser machine, it's very easy to proceed with the phacoemulsification. The trick is to embed the phaco tip in the principal axis and the chopper in the same axis and just create a splitting movement. This movement itself is enough to separate the nuclear fragments. Once these fragments have been separated, a very low phaco power energy, which is 15 phaco power on a Stellaris machine, as in this case, is required. Normally, we would have been probably requiring a phaco energy of 40 to 45 to handle such a cataract. But using the femto laser has softened the cataract and created pre-fragments, which is making this job far more easier. We will notice the followability of the cataract also is far more enhanced after the flax technique. Once this last piece has been aspirated out, we will proceed to do the irrigation aspiration in this particular case. Just remember that unlike a normal phacoemulsification, the irrigation aspiration can be slightly having a learning curve in a femtolaser cataract because the capsule and the anterior cortical plate at times can be cut in the same plane. So it could be difficult or tricky to identify the anterior cortical plate and separate it from the capsule, which was not actually seen in this particular case. Now since the cataract is out, we will be able to notice the knuckles on both sides of the capsulorhexis edge. And if we actually notice, they are slightly at a different angle than what the corneal markings are showing. These corneal markings were done using a gravity marker. So there is no exact coincidence or this correlation between the corneal markings and the anterior capsulorhexis margin. The knuckle on the capsulorhexis margin is slightly away by 5 degrees than the corneal mark. We will proceed to put a toric lens in this particular eye, and all we need to do is align these toric marks to the knuckles on the capsulorhexis margin. This is a 3.5 diopter toric lens being used Now once irrigation aspiration has been done, we need to just go and align the toric lens. I try and hydrate the wounds before I do my file alignment. That ensures minimal or no rotation after the lens has been positioned. We will see against the reflection the small knuckles created by the femto laser, which are exactly pointing to the angle or the placement where the toric lens has to be aligned. Once finally the lens will be aligned according to the knuckle, we will realize that there is some difference between what the corneal marking was showing and what the capsulorhexis marking is showing. The reason for that is that the parallax, which is induced by marking on the cornea and placing the lens in the capsular bag, can induce slight error. This slight error of around 5 degrees also can be compensated by using this Intelli Axis technology. Thank you.